Happy World Hearing Day 2024. I'm Hemprakash Singh, founder and managing director of Software Private Limited, under which we have Software Speech Hearing and Vertio Clinic in India. We have multiple branches at multiple corners in India. I'm very happy that you are joining us, sir, and hoping that all your research until today is very useful to the audiologist and the people having a normal hearing or having affected hearing. And I would like to get some insights from you about importance of hearing as it is as we are celebrating World Hearing Day. Please, sir, please highlight it.
Thank you so much, Hem Prakash. It's an absolute delight and honor to be speaking with you on this occasion, World Hearing Day 2024. It's extremely special day because it almost lets all of us to pause for a second and reflect on how important our hearing is. Everything we do today, if we start thinking about it, it's actually hearing dependent. If I think about my childhood, all the wonderful memories I made with my cousins, with my friends, they were predominantly based on the conversations we had during holidays, during regular time, and the whispering in the nights, right? All that is hearing dependent. Even if you think about the education these days, the traditional model of education is also very heavily hearing dependent. You go to classrooms, you go to universities, there's an expectations that people need to hear well what the lecturer or what the teacher is saying. If we look into entertainment industry, if you want to watch things on Netflix or you want to go to cinemas or movie theaters, again, it's all hearing dependent. If we look at the big things young people enjoy these days, going to concerts, going to stand-up comedian shows, once again, all of them are hearing dependent. Hearing is also extremely important for keep us safe. Imagine if somebody is driving on a scooter or a cycle, or somebody is trying to cross a road. Hearing is so important. It keeps us safe as well. So I think in summary, all I want to tell to everybody who is watching this is our hearing is very precious, and let us all make an effort and attempt to make sure that we can safeguard it. So that's my message to everybody. And a little bit of my background. My name is Professor Raj Shekhawat. I'm a clinical audiologist by training, and I'm a Dean of Research at Flinders University. I'm an honorary professor at University College London, and I'm Public Relations Manager for Tinnitus Research Initiative, Germany.
That's great, sir. And what message will you give to the people who are at risk of hearing, and what should they do to prevent the hearing loss?
I think I remember many decades back, people used to think hearing loss is something which is associated with old age. So if somebody is old, they will have hearing loss. That was a conception many decades back. However, lately, you would see that a lot of younger generation people are actually having issues with their hearing. And if you look at the stats, the number one preventable cause of hearing loss is actually noise exposure. So, on the name of entertainment, we expose ourselves to these dangerous levels of noise without even knowing and realizing that this exposure can actually cause a permanent hearing damage. So these days, as a result of that, we have seen a lot of people in their teenage years, in their 20s and 30s, who have had permanent hearing loss because of noise exposure, which could have been completely preventable. So that's one side of the picture. Then, of course, there are lots of other sides as well. When a child is born, for example, in Australia, New Zealand, England, the countries where I worked in, we have a newborn hearing screening program where everybody is screened so we can do early identification of hearing loss. Also, a lot of people, let's say people in their 50s and 60s and 70s, are also very proactive. If they think that they can't hear their television that well, they can't hear the conversation with their loved ones really well, they seek some sort of an intervention and help, because we all want to have a really good quality of life. And we also know that there are a lot of empirical evidence which documents that hearing loss is also a big risk factor for conditions like dementia and falls and things like that, right? So it's extremely important for the safety point of view, from a really good quality of life of point of view as well, that we need to seek out professional help when we think there could be a potential risk for our hearing.
Since you are into research for so many years, and you are doing your research in one of the world's best nominated universities, so how far have we come in our research? How helpful it is to the public with hearing loss now? What are we going to offer them in terms of services, in terms of hearing solutions, and what could be the best practice protocol for now?
Yeah. Look, Hem Prakash, I think the research world is doing a lot of attempts in terms of finding better solutions for hearing loss. But also, it's very important to understand it depends on the type and the nature of hearing loss. Often younger kids may have otitis media or the infection of the ear. All of that is very easily sort of treated, medically. However, if we are talking about permanent hearing loss for younger kids, there has been a huge advancement in technology. Now we have cochlear implants, we have hearing aids, and even in hearing aids, the technology is way advanced than what it was 15, 20, even 10 years back. So there is a huge progress happening in the technological side of things as well. The idea is to try and offer a very personalized, patient-centered care to the clients, because eventually the model is, if somebody has a hearing loss, and an audiologist or the professional who are offering them solutions, they need to consider the holistic picture in mind. They need to understand the real requirements of your client, whether the client is a teenager, whether the client is a working accountant, whether the client is a stay-at-home grandparent. So based on their specific needs and based on what they need, we as professionals need to work around providing solutions for them, rather than, okay, this is something which you need and you take it. So I think that's a very one-dimensional approach, and I don't think so that's the way forward for any kind of allied health or health intervention for that matter. So I think my message to all the hearing professional is also that please listen to your clients. Please spend time with them to understand what are their challenges, what are they looking for. Don't just go for, this is the best thing I think and this is the best thing you should do. I don't think so it's going to work, and that is why a lot of hearing technology end up being in the drawers. Is to work really closely with your hearing care professionals.
Nowadays, many research are coming up that if patient comes with a problem of hearing loss and they do just basic hearing test and go for hearing aid fitting, the results are really poor. So, what is the importance of aftercare and rehabilitation following the evidence-based practices which are coming out of your research and your students' research uh, nowadays?
So I think, Him Prakash, let me give you a very simple example, right? So when people go to school or university and when they attend a lecture, is attending lecture enough for the knowledge? Definitely not. Have you ever heard anyone topping their school or their university just by attending the lecture and doing nothing? Never happens. Lecture is one thing. Beyond that is the hard work and the homework and the time we spend in terms of understanding the material more, reading more, putting things which we have learned into practice more. Similarly, that's a simple example. You take that example in the field of hearing sector as well. Technological advancements, gadgets, devices are one thing. They're just like that lecture. You can get them, but if you really want to get benefit, it has to be a very well planned, very thought through a rehabilitation process, which is extremely, extremely important. In fact, it's even more important than just the device itself. And that is what is the real strength of a genuine, authentic hearing care practitioner who is really interested in to see how far you have come as a result of a sort of an intervention. So I think aftercare or a client-centered approach is extremely, extremely important. And people need to understand that hearing devices or the gadgets, they are not replacement of our normal hearing. For
True.
example, I'm wearing glasses, right? I can't see things properly without my glasses. Right now, your picture is a bit blur for me. The moment I wear my glasses, it's like crystal clear, it's perfect. That does not happen with hearing. Okay,
True.
nothing
Yeah.
replaces our normal natural hearing. So it's a matter of getting adapted to the advancement in technologies and all the innovative things which are happening, and to let our brain get adaptable to that new technology or the new input which is coming, and let it sink through, and that can result into huge amount of improvements, so as long as we are giving enough time for the adaptation.
True, sir. True, sir. You are also into a lot of research which are into tinnitus and patients. I think there are people who are coming with only complaint of tinnitus. Uh, why it is happening so much around the world?
Yeah. So, Hem Prakash, thank you for that question. It's a very important question. If I look at the demographics of Australia, where I live, 1 in 6 person is likely to have tinnitus. Means it's super common. It's very, very common. There are millions and millions of people around the world who experience tinnitus. But there's a good thing about that. And the good thing is, for most of the people, they encounter it and it just disappears on its own and it's not a problem. But for 1 in 10 person, it lingers on and it starts impacting their day-to-day life. It starts impacting their sleep, their concentration, their ability to have proper communication. And that's when it becomes a problem. That's when an intervention is needed. Now, why tinnitus is so prevalent? There are various reasons for that. Tinnitus is also often associated with some form of hearing damage. Sometimes that damage can be captured in a conventional audiogram, sometimes it's not. Right? So if there's any damage to the hearing system, that can also trigger tinnitus. And there are various management options. To explain things in a very simple term, we don't have a cure for tinnitus. However, if you have tinnitus, there are various things which can be done, which will make it much more easier for you to cope really, really well with it. So I
Okay.
would really recommend people who are experiencing excruciating tinnitus, so please go to a well certified hearing care practitioner in your area, somebody who is using an evidence based approach, somebody who is practicing with research informed attitude, because a lot of things are changing and it's really important. It's a duty of care for all the hearing care practitioners to update themselves with what is happening, because somebody may have studied 15 years back, and what they were
Yeah.
taught 15 years back is very different than what is happening right now, right? So it's extremely important for professionals to upgrade themselves. Just because they have a practice or just because they're working for 15 years is not enough. And I think
True, sir.
hence,
I
yeah.
accept it. Yeah, I accept it. I'm totally in with this.
Right. Yeah. Look, we all are lifelong learners, and I think it's important for all of us as a duty of care towards our clients that we upgrade ourselves, we keep in touch with the latest of what is happening in the field, and always have a very client-oriented approach towards our intervention options. And always remember that we are here to help. We are not here to impose anything on anyone. So it's extremely important to listen very careful to the needs of our clients and try and make sure that we can make that little positive difference in someone's life.
That's great, sir. And I think you are the best example for that, having a continuous learning and continuous research into the field of audiology.
Look,
I would,
hey
yeah,
Prakash, I'm also aware that you are doing your PhD as well, and I think that's commendable because it's not easy to be able to do research while working full time as well. So well done you for
thank you.
continuing to sort of explore the research and do evidence based practice, because that's really, really important.
Thank you so much, sir. My focus is always there, and
Right.
all the directions and instructions given by you, we are following here to have
Good.
only evidence practices to all my clinical centers, and
Good.
all the audiologists are following the same instructions given by you. The last discussion I would like to have, that we are also doing a lot of research into diagnostic protocol. So quickly, just want to understand that if patient comes, what basically to quickly understand the actual problem and to suggest patient that these are the tests which has to be done to actually understand your entire problem near about. So
Yeah.
I think this question will also help the young professional audiologists.
Yeah. Once again, look, I'm going to give a very simple example. If you go to a restaurant and you're really hungry, do you just eat the entree or the salad and you're like, okay, I'm done? No. You have a proper full-fledged meal. You will have your starters, you'll have your main course, you'll have a dessert. So you'll properly satisfied with that meal, right? Similarly, if we are looking into a hearing issue or a hearing aspect and trying to diagnose it properly, it requires a test battery approach. It's not a safer idea. It's not a good idea to just do one test and say that, you know what, this is it. And based on this, I'm going to base all the rehabilitation and everything on that. That's completely ill-informed practice. Okay,
True,
so
sir.
it's extremely important to do a test battery approach where they're using series of tests, where you're using different tests to corroborate the findings, and that is putting you in a best light to be able to look at all the evidence and then take a holistic and a clear judgment about what should be the next step. So if the foundation is not clear, if you don't have all the information correctly by using several series of diagnostic tests, then you are putting your clients at risk, you're putting yourself at risk, and that's not a best practice at all.
True, sir. So at the end, I would ask you to please give your message in 2024 to all the people around the globe.
Look,
Yeah,
thank you
please.
so much. Look, a very happy World Hearing Day 2024 to everybody. Just remember, our hearing is really precious, and let's try and preserve it, and let's try and make the most of it. And so we can all live a very meaningful and happy and a healthy life. And yes, if there are issues and if there are problems, please make sure you contact the right professionals who are there to support you, to make sure that they can meet your needs so that you are in the driver's seat. You get to control what is best for you, and people are there to support you in that journey. So enjoy yourself. Please make sure that you're not exposing yourself to extremely dangerous levels of noise for the sake of entertainment. That's not good for anybody. All right? Enjoy yourself and look after yourself. Bye bye.
Thank you so much, sir.